I'm Dr. David Little, and I'm in private practice in San Antonio, Texas. I'm a general practitioner. I have a multidisciplinary office. I'm also adjunct clinical professor at the dental school in San Antonio, and I serve as clinical director for Little Implant Company. So my practice focuses a lot on implant care. So when we're placing implants, we want to do everything we can to see the end before we start, do a predictable procedure. And one of the things about that is to make sure we have the healthiest site that we can to place the implant. So one of the things I do is all of my patients, they pre-rinse with ORACARE rinse. And not only does it kill bacteria, it also kills volatile sulfur compounds, viruses and fungi. And also, we're breaking up the biofilm. That's what we want. So we want to get as healthy of a site as we can to give us the best chance of having a great implant procedure. So one of the things, peri-implantitis is a big problem in implant dentistry. So we want to do everything we can to prevent that. And so one of the things that we're doing now is, in addition to the pre-rinsing with the rinse, after we place the implant, we're going to go in and place ORACARE gel. And this is 3 times as strong as the ORACARE rinse. And so we'll place it around the surgical site right after we place the implant. We'll leave it on there for about 3 minutes, and then we'll have during that time, we'll have the patient bite down on gauze. Then we'll remove that gauze, and now we'll take some more ORACARE rinse and rinse that area really well, and then go ahead and suture. And obviously what that's going to do is it's going to help the healing of the site and hopefully prevent peri-implantitis. So the reason that this packaged together with the gel that the doctor places at the site and also the rinse that the patient takes home with them, it's real important that we do follow-up care, because once they go home, you don't know what they're doing. But if you give them the rinse and tell them how to use it and you make them a part of the care, you're going to get better results. And so that's why we want to give them the rinse at the same time. Another thing is, if we give them the rinse and we let them continue to use it, it's not only going to help them on this implant procedure, but it's going to help them throughout the rest of their life to get good oral care. And one of the things that's great about ORACARE, unlike CHLORHEXIDINE, it can be used forever and they can continue to use it. The other thing is that patient compliance is better because it doesn't stain. And patients are more likely to use it if it has a little bit better taste as well. Well, implants are a very successful procedure. Their success rate's in the 90%. It's one of the most successful procedures we do. However, if you have a failure, it is not an easy fix. It takes, you've got to regraft, you've got to wait for that, then you've got to place the implant, wait for that. So it does take a lot of time, and it costs money because you want to take care of your patient. It also kind of messes with your confidence. You're worried about what's going to happen. I just think it's really not a good situation. There's no win. So anything we can do to help prevent that. And I'm real big on seeing the end before we start. So I like, pre-planning, using software to plan what we're going to do, see the end before we start. And now at the surgical site, I can go ahead and use this to help treat and try to prevent peri-implantitis before we start. So ORACARE, one of the things I like about it over CHLORHEXIDINE is, one of the biggest things is patient compliance. I have patients that I would put on Paradex and they'd come back for their post-op and I'd say, "You didn't use my rinse." And they'd say, "Well, I didn't use it because it stained my teeth." And so using ORACARE, we don't have to worry about that. Second thing is that with CHLORHEXIDINE, there are some contraindications to using it directly in the implant site. And also, you can only use it for about 2 weeks at a time. Whereas with the ORACARE, we can use it forever. And so it creates that health, and that's what we want patients to have. So we have implemented the post-op care system into our practice, and so every implant that we place, we are using the protocol of pre-rinsing, and with the ORACARE rinse, then using the gel in the surgical site, and then having the patient follow up with the rinse starting the day they leave, and we have enough, we give it to them for 34 days. But the good thing is they can continue to use this on an ongoing basis. And our results have been phenomenal. Our patients have engaged with it, and our post-op visits have been very good.